Thank you, Devin. And wildfires, humidity, and pollen can seriously affect people's living with asthma. And here to talk a little bit more about the breathing conditions that we're joined by is Nurse Christina Paris. Thanks for joining us this morning.
Hey, good morning. And after Devin's weather, I think it's very appropriate that we talk about asthma today.
Yeah, it is certainly an odd forecast. But speaking of asthma, that's what we're going to be talking about today.
Right.
What is asthma?
Sure. So asthma is basically when people, their bodies will react to things that something like you or I would not react to.
Okay.
And so, you know, our lungs, of course, are important in bringing oxygen into our bodies. Our bodies use oxygen for aerobic respiration, which creates ATP. ATP is kind of our powerhouse. So that's what powers our cells, gets things going.
Okay.
It's a big source of fuel. So oxygen is very important. And when you have breathing difficulties, such as asthma, where your airways are going to get narrow, the muscles in your airways are going to spasm, you might get a buildup of fluids or mucus in there. So you're not going to get that airflow like we do. And it can make you feel like you're just not breathing. You're gasping for air, and it's very, very scary for people who have asthma and life-threatening.
So, obviously, it's not a nice thing to have.
No.
So how can we prevent it?
Right, absolutely. So there are things you can do. Of course, you know, with weather like we're having, staying indoors, staying where there's going to be air conditioning, staying out of the wildfire smoke and the humidity and the pollen are going to be helpful. Keeping things clean in your house. You know, you want to keep the windows shut if you can. I know some people don't have AC up here, especially in the cabins. But if you can, keep the window shut. If you can't, it's going to be important that you do things like allergen-proof your pillowcases and your mattresses. You know, you might have to vacuum them or wash them more frequently. Don't use down pillows or things that or fluffy things that can create more dust, more particles that can get into the air. Make sure you, like I said, clean frequently. Make sure you're vacuuming using a HEPA filter if you can. Vacuums nowadays, even the cheaper ones, have HEPA filters, which is good. You can get special filters too for your house that have their extra filtration system. So I would encourage people to use those too. Make sure that you're keeping things clean, vacuumed, wiping down surfaces in your house to get that pollen off, especially if you do keep your windows open. That's really important too.
Yeah, and it's, there's constantly going to be different things pollinating throughout the summer and springtime.
Right.
Because, different trees are blooming at different times. And there's a grass pollen. We can't ever forget about that.
Right.
And it just seems to be coming from everywhere.
Right. And if you have to wear a respirator or something when you're mowing the grass, I mean, do that if you're at high risk for asthma. And keeping a dehumidifier in your house too can help bring down that humidity.
Right. I mean,
we have ours running all summer long.
Yeah. And I mean, it's going to be humid, especially going into the weekend, as Devin was saying.
Right. Exactly.
So, what are the treatments for asthma if you're living with this?
Right. So, if you do notice that you're having more difficulty breathing, especially during these times of years, you want to check for one, allergies, and two, see if you have asthma. And they can do different breathing tests, they can do blood tests, things like that, a physical examination. So go talk to your doctor. Now, if they do diagnose you with asthma, there are medications you can take. There's inhalers they want you to keep with you at all times that can help. There's even exercise-induced asthma. So if you're somebody who gets exercise-induced asthma, like some of the younger kids, you want to make sure if you're going out to play sports, especially in this kind of weather, you bring your rescue inhaler.
Yeah, because I think that's something that, people with very little knowledge like myself about asthma have, is there's always an inhaler involved with it. So what does the inhaler do for people?
Yep, so the inhaler will actually help open up your airways. So it stops that spasming that's closing off your airways. It allows things to kind of relax and open up. But still, if you're having a really serious asthma attack, sometimes you need to get to an ER quickly. People do die from serious asthma attacks. So don't wait, don't hesitate. If that rescue inhaler hasn't worked, you want to get yourself you want to get yourself to an ER or call 911 so that they can get you the help that you're going to need, which will probably be some pretty high potent steroids, things like that, to reduce your body from fighting against itself.
Well, that is good advice to have right there. Certainly, you don't want to be, running about and, having an asthma attack like that and
Right.
seeking the medical attention you need.
Absolutely, absolutely. And you're better off going in if you need to. If symptoms are, like I said, not improving, if you just can't do the things that you normally do, or you have any questions, or you run out of your medication, you're up here on vacation, you're out of your medication, please go get seen in the ER. They can help you out with those things.
Well, fantastic. Well, thanks for coming on in this morning and especially talking to us as the humidity gets up there, the wildfires, you never know when those are going to rear their heads. So it's always good to be aware of the situations that might sort of irritate this.
Absolutely.
All right.
Absolutely. We want to have fun up here. We want to have a safe, fun summer and not have to worry about our breathing.
Absolutely. Well, thanks again, Nurse Christina. Always appreciate your time.
Yeah.
And we'll be right back.